Administering assessments in a patient-centered way. An example. We tend to administer many assessments in healthcare, especially for new patients. And there are good reasons. We gather valuable information on the individual that goes in their chart. It adds to our population database, so we have a good snapshot of our panel. We can identify patient needs and clinical areas of concern, and it helps us to develop a personalized care plan. But we also need to be careful that our assessments do not detract from the patient experience and quality of the data that we collect. If we ask too many questions and in a rote manner, we can impede our ability to build rapport and engage with their patient. This can affect how much they trust us with deeply personal information. The drive to get the answers to multiple assessment questions can hijack the session by the agenda turning into a checklist to complete. And this, in turn, may cause the practitioner to miss opportunities to identify meaningful issues and provide helpful health coaching. So there is an imperative to limit the number of assessment questions in our session and to administer them in a patient-centered way. Here are some basic guidelines to follow. Build rapport and engage first before diving into your questions. Share the agenda. What is of greatest interest and concern to the patient? Listen intently and express empathy using reflections. Elicit the patient's narrative or story. Use a conversational tone and layperson verbiage. Prioritize the patient's needs and preferences along with your clinical priorities. Stay within your role and scope and make a referral when needed. These strategies take practice and are part of a complex skill set that every practitioner should have. Our motivational interviewing training program provides a comprehensive introduction. See our resource at the end of the program. For today's example, we have chosen the Patient Health Questionnaire Brief Version, or the PHQ-2, as it is a very common depression screening that can be used by both clinical and non-clinical staff. This tool is not meant to establish a diagnosis or to monitor depression severity, but rather to screen for depression as a first-step approach. The written version consists of 2 questions. Over the past 2 weeks, how often have you been bothered by any of the following problems? Little interest or pleasure in doing things, and feeling down, depressed, or hopeless. The responses include not at all, several days, more than 1/2 of the days, and nearly every day. You can see that there is a scoring mechanism. Those with 3 or more points should be further evaluated and/or referred to a behavioral health specialist for more discussion. In our example session, we're going to show a health coach who administers this assessment in a more conversational way. Some of you may understandably be concerned about maintaining the integrity of an assessment tool. However, we can reliably gather data for our purposes while still administering it in a more personable and engaging way. These are quotes from 2 of the co-developers of the PHQ tool to reassure you. The PHQ scales have often had minor word modifications tailored to the mode of modification, be it interviewer-administered, self-administered, and clinical or research purposes. It is fine to do so. And, for what it's worth, an interviewer has to strike a balance between accuracy and reliability in the use of the rating instrument, if a research study, and engaging the subject or patient. I maintain and teach that if you just listen to a really good interviewer administering the PHQ or even the SCID, you wouldn't know that the interviewer was simultaneously completing a rating scale unless you saw it in their lab. The interview should sound like a natural conversation. In this brief example, the patient has been referred to health coaching at their community health hub. This is a role play. The person playing the patient is actually a health coach at a community health hub. This is one example of how an assessment can be integrated into a check-in. There's not one right way to administer these questions. Note how the health coach both engages the patient and still gets the information for the assessment. Ms. Thomas, I certainly appreciate you sharing all of this health information. And I was wondering if you had a few minutes, if we could go back to what you told me near the beginning of our session about just not kind of feeling yourself lately.
Yes, of course, of course.
Well, can you tell me a little bit more about that?
I can. Um, if I can just be honest with you, Susan, I just have been feeling a lack of motivation in my personal life and professional life. I am like to pride myself on being motivated, being driven, being ambitious, and ever since we have really been back in the office is when I've noticed it even more that I just do not feel like going to work. I don't feel like getting up. I don't feel like doing anything. I find myself being late on turning in assignments and deadlines. And so it's just really starting to bleed into my personal life. And so I'm just getting frustrated.
Yeah, and I can tell from your voice that you're kind of feeling down and disappointed in yourself. And
Mhm.
I wanna reassure you that this is really normal for people to go through periods like this, and we certainly have some help and resources for you if you're open to it. Before we talk about that, I'm wondering, like in the last couple of weeks, would you say that you've been feeling like this just some of the time or most of the
Mhm.
time? What
Mhm.
what would you say?
It's off and on. I would say I have my better days and I have my bad days. I wouldn't even say I have good days. They're just better than bad. So
Okay,
um it's off and on, but it's to a point where I just don't know what is going on with myself. I have no clue. I feel
okay.
so stuck and stagnant.
Yeah, and that's frustrating and must be even a little scary for you, because like you
Absolutely.
said, this is not like you at all. What about finding pleasure in things that, around, your hobbies or
Hmm.
interests or passions, your
Hmm.
daughter? I know you have a daughter. How are you feeling in
Yes.
terms of pleasure with that?
Yes, she is the only thing that I find myself motivating me to keep going. And that's why I want to figure out why I do feel this way and why I have felt this way for the past couple of months. It's because I want to be my best self for her. I want to
Sure.
be that role model for her. So honestly, that's the only thing. There's no hobbies. There's nothing that I find fun. There's nothing in my life that I feel passionate about except her.
Yeah. Well, I can tell you're a really good mother and you care a lot for her. And the fact that
Mhm.
you're able to still give to her really shows how much, you love her and what a good mother you are. We do have a really nice resource in our health hub. We have a licensed social worker, and she very often will talk to individuals such as yourself that are going through some hard times, and she might be able to kind of help you figure out like what's going on and what type of help that we could offer you.
Mhm.
Is that
Yeah.
something that you'd be interested in?
Yes, I'm definitely open to options. So I
Okay.
will I would love to speak to her.
Miss Thomas, I'm definitely going to have our social worker follow up with you. She'll give you a phone call. Her name is Susie. In the meantime, I don't want to overwhelm you with sessions or anything, but you did set some really nice and meaningful exercise and nutrition goals that I'd love to keep working with you on if that's something that you'd feel comfortable with.
Yes, yes, I definitely would love to continue doing our sessions if possible.
Okay. Well, why don't I wait until our social workers had a chance to meet with you once or twice and that you feel like you're a little bit more on track, and then I'll definitely reach out. And then in the meantime, if you have any questions about the tracking journal that I told you about,
Okay.
just feel free to reach out. I'm here anytime for you.
Awesome. Well, thank you so much. I really do appreciate that.
Thank you. You have a good day, and give your baby lots of loving.
You as well. Have a good one.
Bye-bye.
In summary, the health coach built rapport, administered the assessment in a patient-centered way, and made an important referral to a behavioral health specialist. You can learn and practice these strategies and more in our motivational interviewing training and certification course. We hope this presentation was helpful.